Raj Vaidya sir has already joined. Good morning, sir.
Good morning.
Sir, welcome to Danteswari College of Pharmacy, sir.
Thank you
And
very much.
on behalf of student, staff, and management, I thank you for giving your time and valuable time and going to address our student and staff. Thank you, sir. Thank you for
You're welcome. Thank you.
joining. Dr. Rajvatia sir has did his master in pharmacy, and he's right now practicing community pharmacist for last 34 years at a family-owned Hindu pharmacy at Panaji, Goa. He's ex-co member International Pharmaceutical Federation Community Pharmacy section from 2021 to 23. Is also editor IPA CPD's E-Time, and he is immediate past vice president and chairperson Community Pharmacy Division of Indian Pharmaceutical Association from 2006 to 2012. Sir is a project leader for pilot project on accreditation of pharmacies in India, Indian Pharmaceutical Association in collaboration with Drugs Controller General of India and WHO India country office, that is from 2007 to 8. And he was also a project leader for project on good pharmacy practice, Indian Pharmaceutical Association in collaboration with the Drugs Control General of India and WHO India country office. Sir is also a major contributor towards writing of GPP training manual for community and retail pharmacists and a resource person for training workshop for pharmacists from 2004 to 2005. Thank you, sir. Welcome to Danteswari College of Pharmacy. Over to you, sir.
Thank you. I have a presentation to make.
Sir.
So if somebody may allow me to share my screen.
Yes, correct. Share, correct. Sir. Yes, sir. You can start, sir.
Thank you very much. Thank you, Dr. Sutiranjan Mishra, Principal Sir, for inviting me for this presentation. I'm very much thankful and grateful to you all for having me here today so that I can share some of my views on community pharmacy practice in India. Is my screen visible, sir?
Yes, sir. It is visible, sir.
Okay, I will start my presentation. So I'm a practicing community pharmacist and also associated for long with the Indian Pharmaceutical Association, where we are involved in creating various activities and material and information and developing the community pharmacy practice in India. Now, when I say community pharmacy, it's a little professional word, but it actually means a retail pharmacy. And in India, we call it as a medical store or chemist and druggist. So I may use these words interchangeably, but basically they are all the same. Community pharmacy, of course, is a professional word, and we should slowly move to using that and not say words like shop, etc. Because with time we have to change. This is the pharmacy, our pharmacy where I practice. It's more than 100 years old, coming down into three generations, and I have tried my best to see how we can professionalize it and provide professional services to our patients. This is the interior look of the pharmacy. We have the main allopathic counter, and we also have Ayurvedic and homeopathic medicines. We have 5 pharmacists along with other non-pharmacists who together handle the flow of patients and prescriptions. In addition, we have created this area which is functioning for more than 25 years within the pharmacy itself. This is a patient care area in which we provide professional pharmacy services to our patients, and that includes counseling, instructions to patients, doing weight and height measurements, doing blood pressure measurements, where we get almost 100 patients every day, blood sugar measurements, and also providing information leaflets and referral to doctors, and providing advice and counseling to patients. We also advise and give recommendations on minor ailments with the OTC medications, and any other prescription related queries we address either at the counter or in the special patient care area. So these are some of the patient information leaflets, which some of them are created by companies, some of them are created by us. So we use this as an add-on to give information to our patients. And these are some of our leaflets which we have developed. On the left-hand side, you can see a simple, basic information which we provide to patients who are taking medicines for blood pressure. So there may not always be time to talk on the counter, but they can always go back and read simple tips about blood pressure. The one on the right hand side is which we give along with every antibiotic that we dispense. We strictly dispense only against a prescription, and along with a sticker which is applied on the bottle or the strip, which says that this is an antibiotic, complete the course. We also put this pamphlet inside the package so that they can go home and read. This is also available in local languages. So these are other simple information material. The one on the right side is about blood sugar, why it is important to control it and how to control it. So we give simple information, not too complex, so that it is easily understood by the patients. So this is for patients who are uh, having blood pressure, diabetes, and cholesterol. Again, simple information. So these are some of our information leaflets. Besides this, we carry out various awareness activities and drives in our pharmacy, putting up posters and banners and talking to people specifically in this specific days or on specific awareness weeks or awareness months. So this is the good pharmacy practice manual, which of course was prepared along with the IPA in our pharmacy, and we use this extensively, not only to train our pharmacists, but we also actually implement it in our pharmacy. Has different modules, so our staff, especially the new staff, are asked to read them, and existing staff also time to time we ask them to read this and also carry out various activities. So in our pharmacy, we document, in addition to whatever is legal, we also have standard operating procedures for all the tasks which are there in our pharmacy. So that is also helpful for us for training of the new staff which come in. Then we maintain temperature records of the room as well as of the refrigerator. All the cleaning records, everyday cleaning activity goes on, and whatever is cleaning we do, shelf cleaning, it is recorded. And time to time, staff training goes on, and that also we keep records of that. Now that was a little about our pharmacy where we practice. Now coming to pharmacists in our country, we are more than around 11 lakh pharmacists in our country, and majority of them, maybe 7 to 8 lakh of them, work in the retail or community pharmacy, and we have that many number of community pharmacies all across the country. So almost everywhere we can see retail pharmacies, and we have 3,000 plus colleges with every year more than 1 lakh pharmacists coming out. Now, the big challenge in our country is, see, some of the things are facts and we have to accept it. We cannot hide away from these facts. We should know them and we should try to address them. So, the big challenge is that pharmacist is not always present in all pharmacies. This is a big lacune. And so many times only the certificate of the pharmacist is present, the pharmacist is missing. And in some of the states, this is quite a rampant practice, unfortunately. In some state, it is much better. So in short, the implementation of the law that a pharmacist should always be present is not being properly implemented in our country. So this is a big challenge and a lacune. The other thing is, are pharmacists willing to work in community pharmacies? One of the problems is poor remuneration, that is poor salaries. On the other hand, the owners of pharmacies, they complain that pharmacists lack the skills for community practice. So in this way, whether we should provide professional services first, whether we should professionalize first, or we should ask for salaries first. This is just like the anda ya pehle ya murgi pehle. So this cycle will keep on happening in between these two. So best is to we see how best we can skill ourselves, because our curriculum does not skill our pharmacists appropriately for pharmacy practice, and of course there is poor implementation of the law. So even though community pharmacists are the actual face of the profession, so maximum number of pharmacies and pharmacists should be seen in retail pharmacy. But if they are not there, if they are not wearing apron, if they are not wearing any identification who they are, then obviously the public will not know who is the pharmacist, what is the pharmacist, and then we cannot complain that we don't have proper identity, that we are not being recognized properly. So we also have to do these changes. I am aware that I am addressing a large student gathering. So I have tried to make my presentation student oriented. So what I am talking is more student oriented, because I want to create that awareness in you that students, you are the future of pharmacy in this country. You are young, you are dynamic, and we look forward to you. I frankly look forward to you to bring about larger changes in the profession. Of course, I will shortly later in my talk share to you how student pharmacists are doing great things. So, on one hand, we are struggling for recognition, and on the other hand, do we have sufficient role to play in public health? Now, of course, there are a lot of difficulties. There is too much of competition for pharmacies. There are too many pharmacies in certain areas, and there is a lot of discount war, a lot of discounts being offered to get patients. And then another challenge is that for pharmacies, is many chain pharmacies are coming up, and of course, in the last few years, online pharmacies are coming up. We all know that online pharmacies are illegal. They do not have approval of the law. Even the courts have given them strictures that they should be stopped. Unfortunately, our administration has not been able to do that. So what we often see, of course, is the heavy competition from the onliners and chains for giving huge discounts, 20%, 30%, 35%, door deliveries. All these posters you must be seeing either on the internet, or they must be coming to you on WhatsApp or on your email. So what is happening is that we have, unfortunately, over the last few years, commercialized pharmacy. Rather than professionalize it, we are unfortunately commercialized. We are talking only in terms of money, discount. And quality on one side is suffering. At the same time, professional services are missing. So this is what has happened. Way back in 1970s, even in America, the focus was on product, means of selling the product. But from 1970s till now, they have drastically changed their approach, and they have become more patient oriented. So their focus is patient first. India, of course, was slowly trying to reach there, but in the last few years, looking at such type of things, we are again looks like going back into product focus. So that is not a very healthy sign. So we all need to have serious introspection on this aspect, and things needs to change fast. So coming back to these two things, now the last few lines from here you will see that if it is strictly implemented, the law, it will definitely increase placements as well as remuneration for pharmacists. So right now, as you see in point number one, this is the biggest problem. Pharmacist is not always there all the time. So if that is made mandatory, implemented, and second, prescription medicines are available unfortunately without prescription. So even that is enforced strictly. So these two things, if they are enforced, then pharmacist value will increase, the pharmacist jobs will increase, and remuneration also will increase. So we have to work strongly towards that. Now coming to pharmacy education in brief, India is the only country where we have only minimum qualification of 2 years, that is DPharm. Fortunately, the syllabus was upgraded to 2020 in 2020. It is much better than the 91 syllabus. But of course, 2 years is not enough to professionalize the pharmacist. So it is important to have more education and more knowledge. But that's how it is. Then coming to the B Farm, our curriculum in B Farm is industry oriented and not practice oriented. So B Farm, when they come out, they do not have as much as skills as actual pharmacists should be having to practice at the pharmacy or practice at the hospital. The new PharmD course, 6 years, it gives a lot of clinical strengths to the pharmacist. But then against that, we have to see how willing they are to work in community pharmacy. So these are little problems here and there that we have. Now, coming to opportunities in community pharmacy, in what way can you work? One is work as a pharmacist in either the independent pharmacy or a chain pharmacy. Second thing is you can start your own pharmacy. And the third is you can take over an existing pharmacy. Now, these are some examples or shining lights of examples of many entrepreneurs, pharmacist entrepreneurs who have started pharmacies. Now, this is Tulasi Pharmacy, mainly based in Coimbatore and then spread out in Tamil Nadu and other southern states. As of now, they have more than 60 branches. So, this is just one of the views of their professional look and the services that they provide. So, things are changing. We need to learn from such things. Another pharmacy started again in Coimbatore and with Tamil Nadu with more than 30 branches is Pasumai Pharmacy. This is also having a professional look, large areas, state of the art. This is how they look, and these are the different professional services that they provide. I am just putting to you some things in brief. This is another young pharmacist. He's Mr. Tilak in Hyderabad. He came back from Australia to start his own pharmacy, Maddox Pharmacy. And this is a real good professional pharmacy and doing very good professional things. In brief, I will just share some of the things that I have picked up. I know him personally and I get a lot of feedback from him. So this his website is maddoxpharmacy.com. You can go there and visit it and see what are the things. I have, of course, produced some of the things over there. So this is Mr. Tilak, and this is his pharmacy, professional pharmacy. So they do professionalized labeling, that is dispensing, counseling of medications. They keep their patients' medication profile. This is Tilak, and on the other side is his wife, Sri Devi Tilak. She is also a B Farm. So both of them manage this pharmacy professionally. So one of the activities that they do is medication management review. Their patients' medications, how they are written, they take care of them. They keep a record of them. They talk to the patients. They check for drug interactions, give them advice. Then dispensing of prescription drugs along with a proper labeling. They make their own labeling and they put it on the strips. On the left hand side, you can see cautionary labels. They are also called as advisory or auxiliary labels. So these also they put additionally on the strip or the bottle so that the patient can get more information. And then they do blood pressure measurement and consultation on blood pressure medications. They do diabetes checks and diabetes medication consultation. So they talk with the patient to ensure that they take their medications properly. Of late, they have started doing labeling in vernacular local languages. So one by one, they are doing and adding their professional services. So this is, I think, Telugu, and they are also doing in Marathi. This is what he sent me a few days back. So they also have a smoking cessation program. They keep the medication profile of their patients. They have this type of dose help dispensing of medication for special patients, elderly, who are not able to remove their tablets and remember when to take them. So this was a very good example of Tilak, who is doing professional pharmacy in Hyderabad. Now, this is another pharmacist. He has done his B Farm, Sagar Kulkarni. He has more than 20 years of experience running his own pharmacy in Maharashtra. So he is he's giving a lecture now on different aspects of pharmacy and in the pharmacy education program in Maharashtra. So he started using these good in pharmacy practices and he slowly started implementing them in his own pharmacy. He made the changes accordingly. He created a patient counseling area. He has a lot of health information display. His pharmacy is relatively small, but he is using maximum space available for providing information in local languages also to his patient. So he has trained and his pharmacist assistants and computerized his pharmacy over the years, and he has various standard operating procedures and does various documentation procedures. So he's also doing other professional services. For example, on the left hand side, you can see he is a DOTS provider. So patients come to his pharmacy and he hands over the DOTS medicine, that is TB medicines. So this was a project of the Indian Pharmaceutical Association. So there are different demo devices available for uh, doing demos. He does demos of how to use inhalers, how to use rotailers, does blood pressure checks, blood glucose checks, height and weight checks, keeps records of patients, conducts health camps to create awareness as well as for early detection. This was a couple of years back on his anniversary celebration, 17th. He upgraded his pharmacy, and now he does also diabetic neuropathy check once in 3 months for his patients, regular patients. Every Sunday he does unhealthy Sunday activity where he checks blood pressure and blood sugar of his patients. Every Sunday he calls them. It's another picture. He's one of the few pharmacies which are used to provide pulse polio in the pharmacy. He also provides nebulization services at his pharmacy, especially for children. So he has a nebulizer, and as per doctor's prescription, the nebulization is given to the patient who come there. He has education videos, patient information leaflets. So this was another example of a pharmacist doing professional activities. Now this is from Panvel, Maharashtra. Mr. Santosh Godinde. He is Dhanvantari Medical Stores. In the small pharmacy that he has tried to do as much as professional information and services. So he has an internet connected laptop on which he provides different information to his patient, whatever they needs, provides patient counseling to them, does blood glucose measurements, blood pressure measurements, has different information boards for the patient benefit. Now, there are many such pharmacists in the country. I've just given you example or 4 or 5. And these pharmacies, because of this, what they're doing in brief is that their business has increased. They are themselves getting professional satisfaction of doing these activities, and they receive acknowledgement of these activities from their patients, and they are definitely then provided to provide more services. So who are these pharmacists? They are actually either D-Pharm or B-Pharm. They got inspired after some training session that was conducted in Bombay, and their age was anything from 30 to 50. So even at that age, they got motivated to modify their setup. They were not so tech savvy, because now slowly they are becoming, and they slowly increase their knowledge about clinical aspects and learning how to talk to patients, what information to provide to patients. Now coming to you, you are the future, you are the next generation pharmacists. So you should be ready to take on such challenges. We are looking at you to make such changes happen, because you have the potential, you have the age with you, you can do wonders. So you have been brought up in a tech savvy age, literally with the mobile in your hand, you are born, and you have access to information at your fingertips. What you need is a little bit of hands on training and some exposure. You can do great things. So actually, there is a large difference between what is actually in theory and what is actually practiced. So for that, if you need to have that exposure and hands-on training, you need to spend some time at the retail pharmacy. Whenever it's possible, spend a few hours every week, maybe 1 hour every week, 2 hours every week, or during vacations. And if necessary, work there without pay. Let your enthusiasm be seen by the owner of the pharmacy. You can really understand what pharmacy practice is, understand what are the ground realities. See how the pharmacy works, the retail pharmacy works, what are the problems there, what are the shortcomings, what is the difference between what we think is ideal and what is actually happening in the country. See what people have to say about pharmacy, what is their viewpoint of pharmacy, and see how the pharmacy operates. So this will help you to understand better and provide better inputs to pharmacy practice. So with these insights, you can lead the future generation of pharmacists into the future. So as you become familiar with the different brands and drugs, different generics and dosage forms, it will definitely help you better to connect with your studies. Whether you are in second year, third year, or even now in fourth year, you can understand what you are being taught in theory in a much better way. This is what my experience is based on a lot of training and inputs that I give to pharmacy students who come to me for their internship. So what you need to do is keep in touch with pharmacy practice news, what is happening across the world. There is a lot of information available today on the internet, a lot of information available on social media. You use social media for good things, whether you use Twitter, Facebook, or Instagram. That's the in thing for pharmacy students. You can keep connected with a lot of pharmacy professionals across the world, and you will get a lot of information. What you also can do is find a mentor, somebody either in your faculty or a pharmacy practitioner, or you can look at somebody from the IPSF. Now, IPSF is Indian Pharmaceutical Association Students Forum. I will talk briefly about that, or from the IPA, somebody from there who can guide you into getting a better connect with professional activities. And of course, take part in professional activities in your college. This is how we all start, by doing some little work in the college related to association, etc. And this is how we can all grow up. So basically, you need to be motivated. Teachers can guide you, they cannot spoon feed you. It's up to you how much you can grasp and take from them. You have to develop that ability. You have that energy, you need to develop that ability. What knowledge will I gather? What clinical skills will I gather? And ultimately, only when you put your efforts and you have the determination, will you take yourself forward to success. So plenty of information is available. I've just listed a few websites of the different pharmacy association, and you just go through it. The internet is world full of information. You just need to tap the right resources. Now, this is a pharmacy practice handbook. You can go through this, available free of cost, developed by the WHO and the International Pharmaceutical Federation. It gives a lot of information about pharmacy practice. Now, coming to the Indian Pharmaceutical Association Community Pharmacy Division, where I am actively involved, we do a lot of work towards development and advancement of community pharmacy, providing guiding the pharmacists on providing better pharmacy services and patient care, how patients can benefit. So we tie up with a whole lot of organizations and sometimes some pharmaceutical companies, government organizations, to develop these training programs and to conduct these training programs. Now, this is an example of the IPA's TB Pharmacist project along with the government, where these are actually practicing pharmacists who are providing DOTS TB medicines to the patients who is to come on alternate days to their pharmacy so that they complete their dose. So their pharmacists used to follow up, note down, keep records of the medicines taken. As you know, TB treatment is at least 6 months, sometimes 12 months, and sometimes 2 years. So many of these pharmacies were involved in this project and were following it up. Now, IPA in collaboration with FIP, is a Pharma Bridge, is part of the FIP, where they do student exchange or pharmacist exchange. So these are two pharmacists from India who went to UK and Australia to get exposure in the community pharmacy over there for 1 month. So just few examples. So at IPA Community Pharmacy Division, we develop a lot of education material. We conduct training programs, we conduct workshops and campaigns, and we conduct a lot of webinars. This is one of the productions. This is how community pharmacies practice in different parts of the world. This is a booklet containing practice in 31 countries. This was developed by IPA Community Division. These are the posters for campaign for awareness of responsible use of medicines for the patients. How pharmacists can use these posters. These are translated into 6 languages, These are available on IPA's website. You can easily access them. This on the left is the booklet which we made for responsible use of medicines, again for the benefit of patients. On the right hand side is a poster in vernacular language, again directed to the patients for proper use of medicines. Now this is IPA CPD E-Times. This is a bi-monthly publication which we are running since 2012. Right now we have reached in the 56th issue. This is available free of cost. We circulate it on WhatsApp. It's also available at IPA's website. So this is a e-bulletin which gives information about pharmacy practice and aspects related to that. And the third week of November, as we are celebrating now the National Pharmacy Week, the IPA Community Pharmacy Division develops material year after year for this event for distribution among pharmacists and distribution among public. So this year's theme, as you know, is Join Pharmacists to Ensure Patient Safety. So this theme is targeted towards number one is patients, to create public awareness amongst patients about pharmacists and the work that they do, to create awareness among other health professionals, what pharmacists do and what role they can play. And of course, third is to involve pharmacists and pharmacy association also in propagating this information, and involvement of students and Indian Pharmaceutical Association Students Forum. So as part of this, what has been developed is the NPW activity guide. This is again available on the IPA's website. So this guide gives guidelines what we should do to enhance the role of the pharmacist and what activities we should do during this pharmacy week, who are the target audience, what is the information we should share. And accordingly, a lot of information has been developed and that has been put on IPA's website. On the left hand side, you see, if you click on that, you get the different posters, activity guide, different PowerPoint presentations, which can be used to educate the public. On the right hand side is a poster which has been developed for on the theme, and like this, several posters have been designed, and you may be surprised to know who has developed these posters. Of course, we have guided them, but these posters have all entirely been developed by the Indian Pharmaceutical Association Students Forum. So these are posters designed by students of pharmacy. This is what wonders our students can do. These are their designing skills. This is not developed by any professional or by getting the work done from outside. These are done by pharmacy students. This is a video again which is done by pharmacy students, same students. This is another video. This video is targeted to patients. This video is in general about the pharmacy week. So you can watch these videos also. And these are the main people who have created this material. This is the IPA Students Forum. It is one of the subset of IPA, and this is led by the president, Sainath Chari Ganoji, and a whole lot of other students. They are either third year, fourth year, or PharmD students, or maybe just 1 year after their graduation. So they actively work as a team, and I feel they're doing a lot more work than what we do in the IPA, because they are young and they are dynamic, and that is why I am presenting them to you, so that you also can get motivation and you also can do such activities. Now, this is the presence of IPA Students Forum branches in different parts of the country, and I think there is no branch in Chhattisgarh. So I think that's motivation for you to try and start a branch in collaboration, uh, discuss with your principal and the IPA in your state. These are IPSF state chapters. They are right now in 6 chapters, and they have local chapters in different other cities. These are the number of members, students, forum member, around 5,000 in across 15 states. Maybe there are some members in Chhattisgarh also. I'm not aware, but maximum of them are in Maharashtra, Andhra Pradesh, Telangana, and Kerala. So IPSF Students Forum was formed in 2008, and they have been going from strength to strength. Each 2 to 3 years, new team comes up, and each one does better than the other. So we actually learn a lot of from the students forum, and we learn from them the tech savvy skills. All these posters we are not able to do. It's the students who are doing these posters. We are only giving them suggestions and guidance and some corrections here and there. So IPSF is the leading national advocacy organization for pharmacy students and recent graduates, promoting improved public health through a provision of information, education, networking, and a range of publications and professional initiatives. They are very active on Facebook and Instagram and LinkedIn. Please link to them and get to know more about this and be a part of them. Now that was about IPA-CPD and IPA-SF. Now coming to the last few slides, what I would like to tell you is that there is a lot of scope for doing multiple interventions in India by pharmacists. We can intervene in controlling chronic diseases. It's a huge problem. On the right hand side, I have listed them: asthma, obesity, diabetes, hypertension, coronary heart disease, tobacco cessation. A lot of problems are there. Pharmacists can do a lot of things. We can increase the adherence, that is, whether patients are taking their medications correctly, reduce drug-drug interactions, drug-food interactions, reduce drug disease complication, and reduce the costs of therapy and cost of medication. So pharmacists can do a whole lot of things. They can conduct tests in the pharmacy, guide the patients on self-care, and provide counseling to patients. So my focus of my talk is you, the youth. The youth has the power to change, and my say again and again is that the young generation is our future, and I look up to you. You have digital skills, and the future, present and the future is going to be tech savvy. So you need to keep in touch with technology, improve upon how you can use this technology, and there are a lot of things that you can do. Maybe developing apps. You may not be computer science students, but you have the skills. You can develop apps maybe for drug information, for patient information, apps for patient counseling, or whatever else the young generation can think of, because each one of us has to do something to try and bring about a change. So you as young generation are best suited for that. So keep working on it. Keep the flag of pharmacy flying high. Thank you.
Thank you, sir. Thank you very much for delivering such a nice motivational speech to our young and budding pharmacist. Students and staff, do you have any question to sir? We
Yes,
quick,
sir.
maybe one or two questions.
Yes, sir.
Yeah, please. Himanshu. Yeah, anyone is there?
Yes, sir. Sir, good morning, sir.
Yeah. Your question, please, Himanshu.
I
Sorry, you are not audible. Anyone else?
am I audible now, sir? Hello. Hello.
Yeah.
Hello.
Sir, I have a question I would like you to address, please.
Yes.
Sir, my question is, how do community pharmacists ensure accurate medication dispensing and counseling for patients?
Yeah. First is learning, exposure, and practice. And one needs to be at that continuously. One needs to have proper systems in place. That is the main role of good pharmacy practice. The good pharmacy practice, along with experience and focus. So, whenever any prescription comes, we have to be focused on that prescription, ensure correct dispensing, and use our knowledge for providing correct and simple information to the patient, so that the patient can benefit from that, take the medicines correctly, and also be guided how and when to take that medication.
Stop
If it
करो
is
से
an,
गोटे क्वेश्चन तू पचारे
if it's an antibiotic, then take the antibiotic, complete the course of therapy, why it is given, why you should not stop taking the medication. Even this simple information can go a long way. Then when it comes to blood pressure medications, what time to take them, how often to take them, and that you should keep on taking them regularly. Don't stop taking them. Visit your doctor from time to time. In between, please keep checking your blood pressure regularly. Make a note of the blood pressure and visit your doctor. So such type of simple tips can go a long way. And as you practice more and more, you can gather more and more experience and information. So with that will come the confidence how you can provide the best counseling and guidance to the patient.
Thank you, sir. You have cleared my doubt. Thanks.
Very good morning, sir. Myself, Divyansh from Blood from the Villeshwari College of Pharmacy. My question is that
Sorry, your question is not audible. Can you read it properly?
sir, my question is that what are the measures should community pharmacists take to ensure or enhance patient safety and reduce the risk of medication errors?
Yeah. One is pharmacists have to have the knowledge, information, and the skills. So whenever any medication is being dispensed, whether it is against prescription or whether it is over the counter, pharmacist needs to give that basic information and tip to the patient. Whether that medicine is suitable for the patient or no also can be found out if the patient is asking for it over the counter. Patient may ask for antibiotics over the counter. Patient may ask for painkillers over the counter. But the patient may not always know whether it is going to be safe or not. So whether he is using the antibiotics correctly. There is another aspect is people are asking for a lot of steroid containing creams. They are very common. Some of them are used unfortunately for fairness. Some of them are used for any skin problems. So the pharmacist can make the patient alert that this is not just an ordinary cream. Just because somebody has told you to take, don't take it. This contains the steroid. This needs to be used carefully. If you are having a fungal infection, then the steroid will not only help, it will also create harm. So only an antifungal containing cream, simple cream, can take care of your ringworm. So such type of things, the pharmacist has to be alert, at the same time have the knowledge and be able to guide the patient correctly on. There's so many things that a pharmacist can do by being at the pharmacy counter.
Thank you so much.
Sir, may I ask one question, sir? Sir, it's a very nice session, sir. Sir, during this session, sir, you have suggested various books. Sir, can you please, sir, tell where these are available in physical copies or this is in e-copies we can get, sir?
Any example, sir? Which book?
Sir, actually, I have not noted down, but you have suggested various books which we can prefer.
The Good Pharmacy Practice Training Manual.
Yes, sir.
That is
Yes, sir.
available physically from IPA headquarters. You can
Okay,
procure from there. And the other books which I have shown are there available free of cost online, like the Pharmacy Practice Handbook of WHO and FIP.
Okay, sir. Okay.
Available. If you
Thank you.
can
Thank you.
send me a message what you're looking for, I can try and locate for you.
Okay, sir. Thank you. Thank you very much, sir.
Welcome.
Okay. Thank you, dear students and staff. It was a very interactive session, sir. You have really given many information to our students, particularly on community pharmacy. As the this is the right time to uh, enter into community pharmacy, because a lot of scope, I find a lot of scope are there in community pharmacy. But as you rightly suggested, our pharmacy graduation course is more focused on industry. Hence, most of the students, after completing their degree, they intend to go to industry only. But I think a lot of scopes are there in community pharmacy. As you rightly said, sir, previously, in ancient days, all doctors, those days they were called Vaidyas. They used to dispense medicine, they used to treat also, and they used to formulate medicines. And in maybe 20, 30 years back, all our pharmacists, those who were working in hospitals, they used to dispense medicine on the spot, and they used to deliver to patients. So that is why perhaps we are having that respect in the society. And now it is all in the form of, I mean, strips or blisters. Now we have to only distribute it. And that is why, because it is only dispensing, distribution, no dispensing is there. Any Tom, Dick, Harry or a non-pharmacist also can also dispensing on counter. I think we are most responsible for this, because we don't go to, I mean, stand on the counter and sell medicines. Most of the pharmacists, as you rightly said, they rent it and work somewhere else, or simply for 2 or 3 thousand rupees they rent it. As you said, if we could have stand on the counter wearing an apron, having our name displayed as pharmacist, and if we can tell patients about patient care, even the medicines which are being prescribed by the doctor. We could have checked it. We could have informed them about the use of antibiotics. If we can record their data, if we can the preliminary checks, if you can conduct like BP, height, weight, pulse, and regular awareness camps like diabetic days are there, tuberculosis days are there. If we can have some kind of awareness programs, I think patients will not go to doctors, they will come to us, because we are the people who knows about the medicine and all. But we don't do, we don't perform that. And at the age, this electronic age, it is next to impossible to stop e-pharmacy, sir. But so many negative things are there. It is not I mean, legal also. But we can also do the same thing. We can have data of patients. We can aware them about chronic medicines, chronic disease medicines, those who are using for years. We can intimate them, ki, sir, how the things are going on, whether you have not availed your medicine for this month. If we can send them literatures, as you said, and you have shown 5 6 people doing wonderful work in the interior part of different states of India. I think a lot of awareness is required to our pharmacists, and particularly those who are in retail and distribution centers. And pharmacist refurbished courses are to be required, sir. I think then only we can get back our olden glory or hidden glory, and people will definitely respect pharmacists. It is something really wonderful, profession, where directly we can serve to mankind. So I hope, sir, this was a very interactive session, and we would like to invite you to our campus once. And during that time, I will check with our retail and chemist and distributors. Also, we can invite them, the pharmacists, particularly those who are owning retail stores and this. Outlets, so we can invite them and we can have a interactive session. We need to educate them exactly along with our students will definitely be future pharmacists. So along with them, the older people has to be taken care of. So I request you, sir, on behalf of Danteswari College of Pharmacy, we will propose a session where we can invite all our old pharmacists as well as our students, sir. Thank you very much, sir, for coming and delivering a so
Thank you.
nice interactive session. Thank you, sir. Thank you.
Thank you.
So this is your certificate, sir. This is on e-mode. The physical mode, we will be sending it to you by post, sir. Thank you very much, sir. I hope you will, again and again, we will distribute to educate our students and staff. And as far as IPA Student Federation, we will definitely work on that. Thank you, sir. Thank you very much. Yes, dear friends, how was the session? Students, is it good? पिछले सेशन से तो अच्छा रहा लग रहा है. पिछले बार सिर्फ फार्माकोलॉजी एडीआर पढ़ा पढ़ा के तुम लोग को बोर कर दिए. आई थिंक दिस सेशन वाज वेरी इंटरेस्टिंग. प्रेजेंटेशन ऐसा होना चाहिए. हाँ, he is a very active member of Indian Pharmaceutical Association, particularly on community pharmacy. सर ने बताया कि किस किस लेवल पे काम किया जा रहा है, और आप सभी को लगभग मेडिसिन स्टोर के बारे में आइडिया होगा. जो मेडिसिन स्टोर और जो फार्मासिस्ट का रोल है, वो शायद ही आप लोग कोई हमारे लोकल एरिया में जितने भी फार्मेसी हैं वहां पे देखे होंगे. देखे हो कहीं? नो. सो हमारे जो पास आउट स्टूडेंट्स है, अगर उनमें से अगर 2-4 ऐसे फार्मेसी सेंटर किया जा सके और जहाँ पे सारे इंफॉर्मेशन अवेलेबल हो, स्टूडेंट्स के डाटा, पेशेंट्स के डाटा रखा जाए, अप्रोन पहन के आप वहाँ पे सर्व करो एंड समझाओ दवाई के बारे में, कैसे खाना चाहिए, क्या खाना चाहिए, टाइमिंग क्या होना चाहिए, तो डेफिनेटली पीपल विल रेस्पेक्ट यू, है ना. अप्रोन इज योर सिंबल, और हम लोग प्रैक्टिकल में ही अप्रोन लेके नहीं जाते हैं. ठीक है ना. एनीवे, अगर कुछ पाना है तो यू हैव टू बी सिंसियर, यू हैव टू बी सीरियस. अपने प्रोफेशन के बारे में जब तक सीरियस नहीं होगे, अपने प्रोफेशन को जब तक प्यार नहीं करोगे, तो हमारा कुछ नहीं हो सकता है. एंड इट इज रियली ए गुड प्रोफेशन. यू विल हैव लॉट ऑफ रेस्पेक्ट इन द सोसाइटी इफ यू वर्क प्रॉपरली. थैंक यू वेरी मच. Again, we'll join on the next session. अभी कुछ sports and song का कुछ dance song and all programs are there. Please enjoy your day. Again, we'll join at 1:45. Okay, उसमें भी एक अच्छा सेशन है ई फार्मेसी के ऊपर, ये जो ऑनलाइन मेडिसिन है उसके ऊपर. Thank you very much. We'll again join. Thanks a lot. Bye bye.